I went into the Army in 1992, and I started off as an enlisted person, did a couple of different jobs, but I've always wanted to fly helicopters. Since I was 5 years old, my dad took me to an air show. It's what I've wanted to do. So I really did everything I could to go in that direction, and finally in 1995, I got commissioned and then sent to flight school, which is a year long, and came out into the Missouri Guard. I've flown several different types of aircraft, Cobras, the Black Hawks, different missions, and just retired in 2015. When I was in Iraq in 2006, 2007, flying a lot of missions. I remember one in particular where I flew a night vision goggle mission for 8 hours, and that is strapped in an aircraft with 20-pound weight on your head with the helmet and the night vision goggles, the vest with the Kevlar inside of it and all your survival equipment. Then walking back and forth just between where I was living in my quarters to work was a mile away over great big rocks that it was just constantly, and you're carrying all your what we call battle rattle, all your gear and Kevlar vest and everything with you. And about, I don't know, 4 months in, I was just really, I was popping Tylenol quite a bit, and then nursed it along and kept nursing it along, and then finally in 2014 I went through an Army medical after my last deployment, and did not pass because my condition was getting worse. I could no longer pick up a 50-pound duffel bag over my back and take it to an airplane to go deploy anywhere. It was just miserable. I just couldn't do it. So that's when the Army said, we appreciate your service, but you need to go get fixed. I've done several rounds of physical therapy. I've done, I want to say, 7 or 8 of the cortisone injections into the back. I've done external TENS units. I've done just about everything. I used to be where I have to take opiates once or even twice a day, and this was going months on end. I was getting a diminishing rate of return, so I turned to the VA and said, what else can we do? And that's when they said, well, have you heard of this procedure? There's a specialist over at Boone that does this. And that's when I went to go see Dr. Noble.
Well, of course, it's an honor and privilege to take care of all of my patients. However, when I'm working with a veteran, it presents a unique opportunity to give back to an individual who's made a great personal sacrifice to protect our country and our way of life.
Dr. Noble and the pain management people are wonderful. I went on my very first visit. They explained everything, what was going on.
He really wanted to avoid back surgery, and so spinal cord stimulation became the next logical choice for him. Dr.
Noble recommended the spinal cord stimulation, and after reviewing the materials that came with it from Boston Scientific, I said, you know, this is worth a chance to see if this will help.
Spinal cord stimulation is like a pacemaker for pain. We use electricity to block nerve impulses at the spinal level from even reaching the brain.
The very first night that I had it on, I actually slept the entire night without having to toss and turn to readjust, because my issues are if I ever in one spot for too long, then I get I got to move around. I can't. So even in my sleep, I wake myself up in pain because I have to move and readjust and whatnot. And this procedure has solved 90% of that. I grew up on a farm, and I was never one to sit back and watch work being done. Everybody helps out, everybody does stuff. So unfortunately, my desire to help has hurt me more than help, because I overdo it a lot. So the spinal cord stimulator actually helps so that I can still do some things and not have to come home and take the opiates and be off of work for 2 days or 3 days until my back recovers. I can actually do things again and help out and contribute with the household.